It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Houston area that have helped change people's lives.
Like our first doctor, Dr. Stephen Rose.
Breast cancer is a field of many specialties. I cannot do everything myself. There's the imaging and the diagnosis of cancer, and then of course the surgical part. And so not one person can take care of breast cancer by themselves.
So here at Memorial Hermann Breast Center at Southwest Campus, we really try to approach all aspects of patient care. We try to get the patient through all different disciplines, and we work as a team to do a whole approach to cancer therapy.
Dr. Rose and I met in 2000. I had been in practice for a year, and he was brought on here to develop a breast center. And up until then, it was just a general radiologist who was reading x-rays. And Dr. Rose was very different because that's all he did, was specialize in breast imaging. And as I was specialized in breast surgery, it was an immediate fit.
So it was a very awesome opportunity to collaborate with people who had tremendous experience, large experience in breast surgery and breast cancer, as well as in handling benign breast disease. And it's really very satisfying to work as a team, the surgeons and the radiologists, as well as the oncologists and radiation therapists, working closely together to give the patient the very best care that they can get.
Well, breast cancer has always been an important part of my life. My first experience was back when I was very young, and my mother had breast cancer. She died when I was 13 years old. And so it's always been a part of my life, something that has been important to me. Just like Dr. Rose specializes in mammography and breast imaging, I specialize in surgery for the breast. I'm focused 100% on taking care of breast cancer patients. And that dedication and that focus really drives the quality of the surgery, and it drives the quality of the outcomes as well.
After undergoing a mastectomy, Colleen turned to Dr. Evan Feldman to help change her life. To find out more about Colleen's story and other life-changing stories, log on to bestdocsnetwork.com.
I am an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test and you could save your life or someone you love.
Get screened.
Be a part of 1 million strong.
I started having heavier periods where I would have to, make sure that I was near a restroom, and, kind of got to be about every hour to 2 hours, I would have to check, have excessive bleeding, and so I would not, wear anything that would, have the ability to, show any type of accident, which again is very embarrassing.
It's a very common problem. It affects about 1 in 5 women. A lot of women think they just have to put up with it, and that's part of being female, and sooner or later it will stop. But in fact, it goes on for a long time, and It interferes with their work life, their exercise life, their sex life.
And it started getting irregular too. It wouldn't always be every 4 weeks. I mean, sometimes I would have it 3 weeks, sometimes 5 weeks. So I couldn't even anticipate if we were going on a trip or, you know.
Again, in the old days, 10, 15 years ago, it was very common for the gynecologist to say, well, let's just do a hysterectomy. This new minimally invasive technology was developed called endometrial ablation, referring to ablating or removing the lining of the uterus.
And Dr. Leibman gave me the alternatives and said it's a very short procedure. I trust him wholeheartedly. I mean, I've known him for, 20 plus years, and I would trust my life with him.
She certainly didn't want to have a hysterectomy. So when we talked about this minimally invasive procedure that involved no cutting, no hormones, she was really interested.
And so came in here, cannot stand needles, cannot stand any procedures. I was in and out of here for sure in an hour. And I mean, obviously I did get put under.
The recovery is very similar. It's going home, taking a nap, having some pain medication, and usually that night there is some cramping, but the following day almost everyone is up and about and doing what they need to do.
And went home, slept for maybe a day off and on, and I was back at work the next day. And ever since then I've been perfect and feel wonderful.
Originally, I was having a lot of sinus pressure. Pretty much all the time I had sinus pressure. And I had a lot of headaches. I would have sinus infections pretty much back to back. I'd have several sinus infections a year.
Amanda has consulted multiple Ready Clinic urgent care that does not really address her problem. All they did was to refill her prescription of antibiotics, gave her some antihistamine, and tell her to go home. But what they do is they treat her symptoms instead of treating the cause of her problem.
He basically just looked at my nose and kind of tried to figure out what the problems were based on the symptoms. And he noticed immediately that my turbinates were really big.
The inferior turbinate, it's a normal structure in your nose that everybody has. It has a role of filtering and humidifying the air that you breathe in. So it becomes enlarged and inflamed when it is irritated by either allergies, infection, or pollution in the air. Considering her busy schedule, we decide upon a two-pronged approach treatment. Balloon sinuplasty in office to treat her sinus issue, and inferior turbinate reduction to relieve her nasal obstruction.
I don't really have any more sinus issues. I haven't had a sinus infection since the surgery, and it's been a few months now.
The advantage of balloon sinuplasty is that it can be done in office. There is no general anesthesia. The cost is less than doing it in the hospital, and the recovery time is really quick. There's really no downtime. The patient can go back to their daily activities quickly.
It's actually kind of funny. There's a lot of things that I didn't realize were issues until after the surgery. I know one time I was sitting in my bathroom and I was sitting there and there was a candle about 2 feet away from me, and I actually could smell it. And that was something that I have never done before, and it kind of just hit me. I was like, I can actually smell the candle.
Let's talk about vitamins. There is a lot of misinformation. In the past few years, the studies show us that multivitamins in general don't do the good that we thought they did. It's better to get the vitamins from your food. So multivitamins won't really hurt you, but they probably won't help you. Your mom was right when she told you, hey, anything that you eat that's fruits and vegetables is going to be good for you, especially if they are green or orange. That's where you're going to get the best vitamins that are going to do you the most good. Now, vitamin E can hurt you. It's best not to take more than 200 units of vitamin E. Vitamin D can help you. It's a vitamin that's involved in your immune system, and it helps reduce heart attacks and strokes as you grow older. So you ought to have your vitamin D checked, and if it's low, start taking vitamin D from over-the-counter sources. As far as women in childbearing ages, I think folic acid is good. Mega doses are bad. You don't want to do mega doses of any vitamins. That's where you get into trouble. So avoid that kind of advice that you'll see in the press and on the internet.
Because of my history and being out in the sun a lot and not using sunscreen and not using glasses, I knew that I needed to do something and do a little bit as you get older. Then you're not dealing with a big mess when you're 60 or 70.
Due to her career that she worked previously, she enjoyed a good life where she worked at Club Meds around the world, but obviously you're going to get a lot of sun exposure, and with that sun exposure comes changes in disorder in the collagen and the pigmentation of the skin. You want to rejuvenate that skin, and then you want to protect it from further damage, and then you also want to even out the tone to kind of correct some of that sun damage that she's incurred over the years.
I came over and I talked to Dr. Bancroft, and he said, you know, I really think that my new cream that I've made in my compound pharmacy would really, really help you.
In terms of the skincare products that we have here, we have basically a compounded cream where we're basically taking the cream and adding it to specific levels of the active ingredients for each patient. So you can have someone who has more of an issue with controlling pigment, or needs more rejuvenation. You can work your way up to the level of Retin-A that's appropriate for that patient.
I started using the cream probably about 5 or 6 months ago, and immediately noticed a difference with just the texture of my skin, the feel, the way that it looked, and the glow that it gave me.
When you talk about things like sun protectant, that's the kind of stuff that's working from that point forward. But those damages that you've had, those fine lines, those wrinkles, the pigment, the age spots, those kind of things, obviously the ingredients in the skincare products we use can help even out the skin tone for that. And then the rejuvenating component will build more collagen, build more proteaminoglycans, other protein structures within the skin. As you get those built up, they allow your skin to hang on to moisture better. Skin that hangs on to moisture better will appear plumper. Skin that is plumper won't have those fine lines that people complain about, and so it really will start to freshen and turn the skin around so it can look better.
You look so youthful, your skin's glowing, and I call it the magic cream. So I let people that have asked me know that I've been seeing Dr. Bancroft and that he has this wonderful cream that I call the magic cream that has worked magically on me. And several of my friends have come here and are using it and have noticed a great difference as well. So it's a lot of fun.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage, and that they were decayed. And he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth. And George is a very outgoing person and likes to smile and has a great smile. And so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw, and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and complete it in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
For more information on any of the amazing doctors you've seen on today's show, just log on to our website, bestdocsnetwork.com.
Bestdocsnetwork.com, also the #1 medical video source as far as educating the public. Up next, our next best doctor. It's bariatric surgeon Dr. Robert Marvin.
To be honest, I was kind of nervous that morning. You know, I was really nervous. I sat there and I didn't really try to think about what I was going to have because, you know, I knew that I was fixing to go in there and have major life-changing surgery. See, I had my surgery October the 25th, 2012. This is February the 15th, 2013. So 10 days shy of exactly 4 months. And during that time, I've lost 93 pounds.
I think he's doing okay. He's in the normal range, but he could probably be doing better. And I think most of it goes to the fact that he's not putting in a whole lot of time exercising. The biggest problem we have to overcome afterwards are some of the problems that existed before the surgery.
Some of the challenges are some of the things that he was telling us about, not eating throughout the day, skipping meals, relying on fast foods. We've become so accustomed to doing those kinds of things and not planning what we're going to have and not thinking about eating. We kind of go until we get hungry and then we want to go pick up something fast and have a quick fix. But for bariatric patients, that's just not as easy.
As far as how I feel now, I feel better, I sleep better, I move better, I get around a lot better. You know, I'm more active and yeah.
There are 3 key elements that people, and anybody wanting to lose weight can use these also, is eating frequently. To eat frequently to allow your body to burn the calories all throughout the day instead of loading everything on to the end of the day. Second is eating foods with protein. And third, water, drinking plenty of water. Water helps our metabolism as well.
You know, he's a young man. I think it's ideal to take care of this problem earlier in life. We already know the risk is there when we look at the patient's body mass index and their other medical problems. So there's no real sense in waiting to take care of that problem. It's better to take care of it earlier in life before it develops into something worse. And it's also better to take care of it earlier in life because they're better surgical candidates. They're going to go through the operation much easier.
I had 2 children and I nursed them both, and my breasts were completely saggy and gone.
Aisha came to me after she had 2 children. She was interested in improving the appearance of her breast after breastfeeding and childbearing. They had lost some of the fullness, and that typically happens after giving birth.
I simply wanted to go back to the way I looked before I had children. I didn't want to look unnatural in any way, and he completely understood that, and he had a very good understanding of what both me and my husband wanted.
That's the most common question, is can they get that body back after children? They may not necessarily get that exact body, but we certainly can remove the extra skin, tighten up their waist, and give them that figure back that they had before.
The procedure went very well, and the recovery time was easier than I thought. I mean, I thought the tummy tuck, which I almost didn't want to do in the beginning, and I ended up doing, which I'm very happy with, was actually much easier than the breast augmentation. I was probably in bed for about 5 days, and then not really back to myself for about 2 weeks. But 4 to 6 weeks after that, I was completely fine, like nothing had happened. I felt great.
Typically, after having children, women have extra skin and some fat along their tummy as well as on their hips. And this is, even with all the exercising, many people can't lose that weight. And so if they've completed their childbearing, that's the perfect candidate. With the breast, many times again, there's postpartum involution of the breast. So many times again, after childbearing, they can't reverse this effect. And again, that's a good candidate.
He was very, very nice. He was very applicable to my needs. You know, he talked both to me and my husband about what kind of results I wanted.
Someone who, like herself, who's very fit and wanted to enhance the appearance of her breast after childbearing, this was a perfect case for her.
And he was so professional and so nice. It was fantastic, fantastic experience.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s. The average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
I am a World Series champion.
I am a husband.
I am an advocate.
I'm in the fight for colorectal cancer.
Because I lost both of my parents to this disease.
Because of my friend who died 120 days after his diagnosis.
As a survivor, I want to spread the word so everyone out there knows the importance of early screening for colorectal cancer.
One simple test can save your life or someone you love.
Get screened.
Be a part of 1 Million Strong.
We are 1 Million Strong!
I think there's a lot of confusion now about exactly what an allergist is, because a lot of people do allergy testing that are not board certified in allergy and immunology. So what we see actually in this practice is not always allergy, but people come to us because they think that it might be allergy.
According to Dr. Dickens, allergies really come down to having a problem with the immune system.
Allergy is really just an abnormal response of the immune system that some people have, and they react to things in the environment that really aren't harmful, but if you happen to have an abnormal antibody called an IgE antibody, then you start to react to things and the response actually harms you more than it harms that ragweed pollen.
Many know living in Houston can cause allergy problems. The reason?
I would say because we're very humid and moist and warm, we see a lot of mold problems here, and people can develop not only allergies, but they can develop a chronic allergic reaction to that in their nose and wind up having polyps and then develop asthma, those kind of problems. So we see a lot of mold because it's always either heavy
are extremely heavy. Dust mites because the environment is again very moist and warm, and they can get down in the carpet and into your homes.
When it comes to helping people with allergies, Dr. Dickens' Allergy Clinic does it in a unique and special way.
We try to have the nice art in the office, that they feel very comfortable when they're here, that it's not sterile, that the staff knows them well over the years, and we try to spend a lot of time knowing their particular story and how they would respond best. So I really think it takes a village in a way, and I have a very nice village here. Wonderful staff, very well trained to be able to recognize different kinds of allergic emergencies and treat them quickly and call the doctor when necessary, and really just make the patients feel very secure. That's what we try to do.
How do you know if the chest pain you're having is due to a heart attack or something that's not quite as serious? That's an important question. First of all, chest pain that's due to a heart attack is usually dull, not sharp like a knife. Usually comes on gradually, not suddenly. It's usually moderate, not severe, not mild, and often it will radiate to your left arm, into your neck, and is often accompanied by a cold sweat. Sometimes you'll become nauseated, sometimes you can become short of breath, and generally you just feel bad. People find themselves getting pale. Those are the symptoms of a classic heart-type pain that may indicate a heart attack is beginning to happen to you. There are other causes of chest pain that aren't nearly as bad, but those are the ones that are accompanied with heartburn and don't have the typical symptoms that I've just described.
I came for the treatment for my toenails most of all, but all my all my toenails were bad, really bad. They were in bad shape and they were discolorated, like some white stuff on them. How to say? They were disattached from the nail bed in one place especially, and was kind of yellowish too.
Ms. Ina Yoshova came to my office complaining of fungal toenails. Very common thing, especially you see it in summertime. It's very prevalent. It's a fungal infection of the nails. The nails are discolored, and she wanted them treated.
I keep my body in shape, and I want to be healthy, and I want to have everything perfect. So it's one of the things. When I found out that something is wrong, I couldn't go for some time because I was busy. But I told to myself, no, I have to.
It's basically a YAG laser, and it creates this intense heat, and it kills fungus, bacteria, virus, and it kills it at the root of the nail. That's where the nail begins. From that point on, we have a protocol in place to prevent reoccurrence, because probably most of the problems that have occurred in the past is even prior to the laser with the oral medication was that you would get rid of the fungal infection and then it would come back. So you also have to do your part to make sure that you don't get a recurrence, because once you're susceptible to fungal infection, you remain susceptible the rest of your life.
I figured out that I have good results because when I could see there my nail growing, the new nail will come pretty and doesn't have anything, like no fungus, nothing, no discoloration. It was pretty and nice and healthy nail.
The risk of a fungal infection is not just the appearance, and so you don't want to wait on it. You want to make sure you come in early because you don't want to go to that severe category where you might require multiple treatments. It's better to treat it early on. Not only that, the nails, when they become fungal, they become yellow, thickened, discolored, hypertrophic, and you can develop ingrown toenails. That's a serious risk because that's an infection, and that requires a surgical procedure.
I got new nail bed, new nail, and it was like pretty healthy.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the Houston area that, of course, Candace, have helped change people's lives.
And if you'd like some more information on any of those doctors, just log on to our website, bestdocsnetwork.com.
And if the public has a comment or question for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com.
Thanks for tuning in. We'll see you next week.